Good evening and welcome to our COVID-19 update. I am Ladi Akiridoluale. Here are the highlights at this hour. Nigeria seeks collaboration with India in the possible production of vaccines for COVID-19 and other ailments. Chief Judge of the Federal High Court, John Soho, goes into isolation as one of his aides tests positive. And British Prime Minister Boris Johnson announces further easing of restrictions, expecting largely normal living by Christmas. We'll get to the collaboration story between Nigeria and India in a moment, but in the meantime, members of the Niger State Assembly Ad Hoc Committee on COVID-19 are digging out facts on the spending by the state government in the fight against the COVID-19 pandemic. The lawmakers say they are not satisfied with the explanations given to them by the state task force on COVID-19 and decided to go on a fact-finding mission to the isolation center themselves. Our crew in the Niger State capital joined the legislators on the visit to the isolation center along the Eastern Bypass.
This is the dressing room for the isolation center here at the Mina Bypass in Niger State. And this is where you need to get kitted, wear all the personal protective equipment before you go into the isolation center. It's not really an easy one because I could barely breathe. But I need to do this before I go into the isolation center. Now, the reason I'm here is because the members of the Niger State House of Assembly are on their investigation of the Niger State Task Force on COVID-19. And they are at the facility here to see for themselves what the state government has been able to do with the resources it has budgeted for the fight against the pandemic. So we'll go in now and see what's inside. So we are within the isolation center now, and the Director Public Health at the Niger State Ministry of Health is giving the members a brief on the activities of the ministry here at the isolation center. So we have a member of the Ad Hoc Committee of the Niger State House of Assembly on COVID-19, Honorable Engineer Mohammed Aruna. Sir, you've gone round to see some of the facilities here. So what's the response of the State Assembly?
Yeah, actually we are here to ascertain the submission of the task force with regards to facilities they have provided for the fight against the pandemic, and that is why we are basically here. Yes, and so far we have seen what we have seen. We will continue with the interface with the committee.
So basically, what is the objective for this oversight function that you've embarked on this afternoon?
To find out justification for funds that were expended so far in the fight against the pandemic in the state.
How long have you been on this investigation?
For more than a month now. So we have had series of interface in the office and the assembly. And now we are out to the site to see for ourselves.
Okay, at the moment, what we know is that there is no patient here at the isolation center because according to the official of the Niger State Ministry of Health, the last patient was discharged yesterday. That's the update from Niger State. Emperor Simon for COVID-19 update.
Staying in the north, but moving to Kano State, where efforts are on to reduce the number of infections with recent data suggesting a spike in the number of cases in some local government areas. Torani is one of the 18 local government areas in the state most affected.
Torani has been identified as one of the local government areas in Kano State where the guidelines for the prevention of COVID-19 are not observed. The cited markets and motor parks give credence to this. The level of compliance to prescribed protective measures is low. Many are not wearing face masks, one of the basic preventive items easily affordable. Majority of the residents here have personal reservations about the use of protective kits. Others believe that the virus either does not exist or is not as grave as medical experts warn.
The idea of going to quarantine somebody here is very difficult because their way of life, way of business, they need to go out, they need to do this, and they have to shop from somewhere to bring to their daily home for feeding.
Understanding how the virus is transmitted can help communities curb its spread.
One thing that is very important is for people to take action as individuals. They should maintain the habits of regular hand washing with soap and water, use of hand sanitizers in the absence of water supply, and then to ensure social distancing.
More testing is required as experts give reasons for possible increase in cases in Taurauni local government area.
80% of the infections are mild, so the individuals do not even know that they have been infected.
In the absence of a vaccine, increased awareness and compliance to the COVID-19 preventive measures are of top priority to ensure a decline.
Even if a vaccine is developed, in probably 2 years' time, that vaccine will lose its potency, and then a new one has to be reinvented.
The ease lockdown brought relief to most people. Having another lockdown can only be more worrisome. Residents of Taurauni are directed to keep on with the washing and sanitizing of their hands and observing social distancing.
The Chief Judge of the Federal High Court, John Soho, has gone into self-isolation following a confirmed case of COVID-19 among his aides. A statement by the court's acting information officer, Catherine Obi-Wandu, says the Chief Judge has also ordered some key staff in his office to do the same. The statement adds that they are to remain in self-isolation pending the outcome of tests conducted on the Chief Judge, members of his immediate family, and close associates. The Chief Judge is further encouraging strict compliance with the precautionary protocols against COVID-19. We can go back now to our first story. The federal government is appealing to the Indian government to collaborate with Nigeria towards finding a vaccine for COVID-19. Health Minister Dr. Osage Ehanire made the appeal in Abuja when the Indian High Commissioner to Nigeria, Mr. Abkay Thakur, donated a consignment of essential medicines, including hydroxychloroquine, to the Nigerian government. According to the minister, Nigeria will be glad to join hands with scientists in India in research for a cure or production of a vaccine for COVID-19.
An area of interest that we would like to stress is the vaccine production. We are also aspiring vaccine-producing country. The country, Nigeria, is presently in a joint venture with a private company to explore vaccine production and meet the needs of our country. We should like very much to be able to collaborate with you, with the advanced science in India, to address the vaccine needs of our country and of our sub-region. The aspiration of the whole world now is on the development of vaccine against COVID-19. This is something that the whole world looks forward to, and something that I believe that most countries in the world are working on. Nigeria will be most interested if there is a way to connect our scientists with your scientists, to share knowledge, to share experience and advances, and whatever it is that is required for early production of usable vaccines against COVID-19. We hope that India will be among the first to get it behind the vaccine production, and that we shall be joining you hand in hand as partners in that endeavor.
In Edo State, Nigeria's south-south region, the government is insisting on the importance of enlightenment campaigns as a strategy to fighting the COVID-19 pandemic. Our correspondent, Osaze Obaze, brings us the update on the efforts in the state to curb the spread of the virus.
Life, as it were, is almost back to normal in Benin City, the Edo State capital, as people are carrying on as though the COVID-19 pandemic is not an issue for concern anymore. Guidelines stipulated for curtailing the spread of the coronavirus are being violated, especially wearing of face masks and social distancing. Amidst the fears of escalation of community transmission, what plans has the state government to ensure better compliance of the people?
We have intensified risk communication. We have continued to sensitize the public, make them understand the reason why it's important to keep to the regulations of NCDC for managing the spread of this disease. Wash your hands frequently, wear a face mask when you're in public places and crowded places, and so on and so forth.
However, the government believes that Edo State has not done badly in terms of management of the crisis.
We have a very functional isolation center, in Stella Obasanjo Hospital. We also have in University of Benin Teaching Hospital and in Ira Specialist Teaching Hospital. In Edo State today, I think we have capacity for more than 500 patients at a time, who come down with COVID, and we have not yet exceeded bed capacity at any point in time.
We're at the Stella Obasanjo Hospital right here in Benin City. As you can see behind me, that's the isolation center here. However, this is a restricted area. In Benin City, Osazo Obaze Channels Television News.
Staying in the South-South, Governor Ifeanyi Okowa of Delta State, who recently recovered from COVID-19, along with other members of his family, made his first public appearance recounting his experience. The governor at a family Thanksgiving at the Government House Chapel in Asaba said that COVID-19 was real and asked those who think that his family was giving money to declare that they tested positive to have a rethink. Dr. Okowa stressed that the best way to avoid the devastating disease was for everyone to accept it's a reality and abide with the prescribed protocols, which he says would be enforced in the state.
Thank God that my daughter went for that test, because we did not even think that the symptoms of severe was going to be COVID. And we decided after she tested that all of us should test, having minor things here and there. And you will not believe it, that it attacked the 3 generations in the house, because we're all living in the same place. Myself, my wife, our children, and our grandchildren, except one, the youngest of them. Because they are goods. A very terrible thing. But thank God for everything.
In Africa, 10 countries account for 88%. That's 440,672 of all reported COVID-19 cases in the region. South Africa accounts for more than half of all the cases, while other countries on the list include Nigeria, Ghana, Algeria, Cameroon, Cote d'Ivoire, Kenya, Senegal, Ethiopia, and the Democratic Republic of Congo. 33, that's 70% of the countries in the region are experiencing community transmission. 10, that's 21%, have clusters of cases, and 4, that's 9%, have sporadic cases of COVID-19. The region has also observed increased incidences of importation of cases from affected countries within the region, largely fueled by long-distance truck drivers and illicit movement through porous borders. As of the 14th of July 2020, cumulative total of COVID-19 cases on the African continent had exceeded 600,000 cases and is now at 625,300. This includes 503,122 from the WHO African region and a total of 122,178 of the 7 African countries in the WHO Eastern Mediterranean region. Additionally, 13,772 deaths, that's a case fatality ratio of 2.2%, with 316,114 cases that have recovered have been reported on the continent. Let's come back to Nigeria, where in the last 24 hours, 595 confirmed cases were reported from 23 states and the Federal Capital Territory. 293 cases were discharged in 14 states. Abia had 70 cases, Kaduna 64, Edo 51, Akwa Ibom 29, Gombe 20, the FCT 19, Ogun 12, Rivers 12, Enugu 8, Oyo 3, Anambra 2, Imo, Ondo, and Sokoto 1 each. 9 deaths were recorded in the last 24 hours in 7 states. Ebonyi had 2 of those. Edo had 2 as well. Adamawa, Anambra, Bayelsa, Kano, and Lagos had 1 death each. The provenance from the NCDC report is that of the cases, only 2% have travel history. 628, that's 25%, are from contacts. 8,716, that's 73%, are from unknown exposure. About 60% of known infectious diseases in humans and 75% of all emerging infectious diseases are zoonotic. Yes, zoonotic. According to a new report published recently by the United Nations Environmental Programme and the International Livestock Research Institute. Preventing the next pandemic, zoonotic diseases, and how to break the chain of transmission. The report was released on July the 6th, celebrated as World Zoonosis Day. It may be the worst, but it is not the first, according to the executive director of UNEP, Inger Anderson, who wrote the foreword to the report. Zoonotic infections can be bacterial, viral, or parasitic in nature, with animals playing a vital role in maintaining such infections. Examples of zoonosis include HIV and AIDS, Ebola, Lyme disease, malaria, rabies, West Nile fever, and the current novel COVID-19. I'm now being joined by a professor of wildlife resources management and herpetology at the University of Uyo, Akwa Ibom State, Adam Enyang. He joins us from our Abuja studios. Professor Enyang, thank you for your time and welcome to the program.
Thank you very much and good evening, viewers.
How exactly do these diseases go from animals to humans?
Well, there are a lot of pathways that these diseases cross from animals to humans. You know, in Nigeria, for example, quite a number of people consume wild animals as bushmeat. And then when you go around different parts of the country, you also see people who trade live wild animals like monkeys, rodents. In fact, in certain parts of the country, you will see animals at the side of the street, different species, birds, even reptiles like crocodiles and so on. People delight in trading them as bushmeat. They also trade them as pets. Some are exported out of the country, and for this reason, they have these contacts with animals. You see young children in the villages going to hunt for rodents, and as much as we know, the bats that we have, different species of birds, they have, corona in their system. As vectors, they carry this and they are not, suffering from it. And also, you remember, you might have recalled or heard about the first corona case that came from a mammal. It came from the African civet, an animal that we find almost all over Nigeria and all over sub-Saharan Africa. That was as far back as 1984. And then this animal, people eat them. People keep them as pets. The mongooses, in some households, like in India, they keep mongooses at home. So here in Nigeria, you have, for instance, hunters who, when they kill the mother animal, they take the babies. And when they keep them at home. They don't isolate them. They don't screen them. They don't know what disease that this animal is carrying. And the next thing is that something passes, even in butchering. When an animal like a chimpanzee is killed, somebody stays there to butcher it. He carries it from the bush. He doesn't wear any hand gloves, and he has contact with the blood. So a lot of these diseases can easily transfer their pathogens into the human being because the For example, the primates, the monkeys. If you look at our chimpanzee, it has almost 99% equivalent DNA with the human. And so whatever the chimpanzee is having can easily come into the man, and when it comes, it becomes a suitable host. And then mutates.
At that point, Prof, let me put you on pause. We need to take a break. Prof, we need to take a break. Please hold that thought. We'll take a break. When we come back, I'll allow you to conclude that thought, and then we'll move on to the rest of the interview. Please stay on with us. Welcome back to our COVID-19 update. Before the break, we were talking to Professor Edem Enyang, and he was giving us several of the pathways that some of the viruses, including COVID-19, take from animals to humans. Professor Enyang, thank you for your time, and thank you for staying with us. Beyond how these things get transferred, I mean, from what you've said so far, some of these practices are cultural across the country. People eat all kinds of exotic wildlife and all of that. Moving on to the issue of how this animal to human transmission can be broken. What can you tell us about that?
Well, first and foremost, we must understand that animals, especially those mammalian species that are very closely related to humans, for example, the primates, those are the monkeys and the great apes like gorillas and chimpanzees. All these animals are here in Nigeria. If you go to a place like part of Port Harcourt, you will see the people trading them on the street side. You go to Mina, you go to Kaduna, and so on. Even in Gwagwalada, here in Abuja, you see these animals on sale. Now, these are illegal activities that should be discouraged because the traders have neither the knowledge of the zoonotic, pathways or the potential risk of taking an animal from the wild and bringing it to, a human environment. So, number one, environmental sanitation that we do at a monthly level. We need so much sanitation in our environment. We need to discourage illegal trade in bushmeat in the marketplaces. We need to discourage people keeping exotic species at home as pets, because unless these animals are free of these diseases, some, as you rightly mentioned, we have the ectoparasites, we have the endoparasites, we have as simple as flu. If I have or anybody has a flu now, and you are in contact with a chimpanzee or any monkey, you sneeze around it, it will capture it. And the same thing if the monkey should sneeze. So except in the zoo or in a laboratory condition, ordinary people should not keep these monkeys. But you see that in households, they keep parrots, they keep all kinds of these animals and interact with them. Their feces and their urine are sometimes laden with microbes and other disease elements. Aside from those ones that may come from contact from butchering, contact from eating, I want to make it clear that there are these viruses or bacteria, some conditions that exist in the body of the animal. Even cooking it will not make the animal safe, because there are some, items like the cyst of the or reproductive part of this animal that the heat of cooking will even be the means of activating it. So today we talk about climate change. The change in temperature of the natural environment helps to bring back to life dormant viruses and other bacteria that could have been, in the soil, in the dust. Take, for example, if you look at tetanus, for example, it's simply found in the dung of some of our bovine species like cattle and horses and so on. And when we move these cattle across the country to all directions without control, as they keep excreting and dumping their dung everywhere, once it dries and become a particulate in air, as vehicles are moving and spreading this thing, that's how the tetanus finds its way to all places that they don't used to exist before. So the diseases are there. There are even other diseases that have plagued us, like the, Lassa fever that we talk about, the Ebola that was here, the SARS, severe acute respiratory syndrome, and all other corona, because the COVID-19 is a new corona. We've had corona before COVID-19, but they were not as virulent as this. And even as I'm talking today, we don't pray for it, but we should be aware that viruses mutate, and over time, the corona-19 may mutate to some other level. And this is why we must maintain not only safe distancing with fellow human beings, we must maintain safe distancing from animals, including domestic animals. So
I'm sorry to cut in at the point. I'm sorry to cut in at the point that you reached, because I want to take you up on something you've just mentioned, which is that you talked about mutation. Those who have been watching and listening, we're already hearing that new viruses are already preparing to make themselves felt. There is a resurgence, as we are told, of something like akin to the bubonic plague happening in outer Tajikistan. In that area, there is the swine flu, the one related to pigs, that is again being refound in China itself. Now, again, it does seem as if just as we are getting the handle of one, another one makes itself felt.
Right. Actually, the time span, if you take, for example, I want to bring it to the common man's level. If you look at a simple thing like a fungi, the mushroom that we eat, you can see a mushroom blossom in the morning in the forest or in a garden. And by evening time, the same mushroom shrinks. And tomorrow it is gone. You don't see it again. It doesn't mean that this mushroom and the pores, that it's its reproductive particular, is no longer there in the soil. It is still there, but in a different stage. And because of either moisture level change, temperature change, or other activities within the soil, will make that same mushroom at a particular time, it comes back. The same thing happens amongst viruses. There are viruses that have been deposited inside the soil for 100 years, but a simple action in the environment, a natural reaction, can cause it to come back to life. A place that floods get to that it wasn't there before can generate new sets of viruses. And the old virus that you had known, which scientists may have isolated in the laboratory, can mutate into something else and come even more virulent. It may cause a resistance in the system. It may cause a resistance against a vaccine that comes. And as such, we always try as much as possible, even in the laboratory, to monitor the transition from stage to stage so as to be able to produce a counter product like a vaccine that can take different stages. This is what we do when you, for example, I'm in the field. I do a lot of necropsy with animals. I interact with them while they're in the field, but we never forget to change our reagents, to change our protocol so that we don't get exposed to the dangerous viruses that are waiting there, looking for suitable environment and hosts to, populate themselves.
Finally, I would want to ask you what your view, I mean, the fact that you are in the field and you understand this very well, what has been your own view, or what's your view about how Nigeria as a country has tackled the issue of COVID-19, how we have gone about it? almost more than 4 months in now, close to 5 months in now. Our case numbers are approaching 35,000 from just over 200,000 tests. People, as some of the reports on our program show, are not complying to the protocols and so on. So what do you make of it? Are we getting a hang of this? And how do you think we can go about it?
Well, the case of Nigeria is very pathetic as far as the attitude of the people is concerned. Nigerians have not, accepted the reality that the virus, COVID-19, it's around us. At the beginning, around April, you found people in Abuja and other city centers, they go out jogging in the morning and jogging on the street, back and forth, old and young. It became possible to see people playing football on the streets and so on. These were very dangerous actions on the part of Nigerians. And so, the mere fact that the rural population of Nigerians, while we were observing lockdown in Abuja and elsewhere in the city, the rural people went about their business and the farms. They say it's rich man's disease and so on. This is completely erroneous and a dangerous trend. So far the government has done so much. Information has been all over the place for those who care to listen. And as it were, wearing nose mask, social distancing, washing of the hands, the use of hand sanitizer are all available to us. But I want to say, there is no single solution to the pandemic. It's a combination of things that has to be done. For example, at my own level, I have been able to produce the disinfection machine, which I first encountered far back 1999 when I traveled to Australia. I used a disinfection machine. This is how I got the idea to produce a disinfection machine, which some people may argue that it doesn't work, but it works. That's why I'm safe today. That's why for over 25 years of my life, I've been dealing with wild animals, living in the forest, going all over the world to do this, and I'm not sick. I'm safe from the virus. We must obey and believe as a people that to stay safe, you have to obey all the protocols. You have to change your lifestyle. Those who eat bush meat should run from it. Those who sell those animals, the government, through Nesria, can go ahead and impound these animals and send them to zoos where experts can take care of them without, risking the life of people. Because if it starts from a seller, it goes to the wife at home, from the wife to the child, and the cycle goes around. So government has responded well. It's left for our people. It's left for you and I to change our attitude and stay safe, play safe, and live a very safe life.
Professor Edem Enyang, Professor of Wildlife Research Management, thank you so much. Thank you so much for your perspective this evening. Thank you for your time on our COVID-19 update.
It's a pleasure, sir. Thank you.
Let's go to Sheffield in the United Kingdom, where we're being joined by Dr. Raphael Peter Galley, who is a virologist as of the Faculty of Medicine, Dentistry and Health at the University of Sheffield in the United Kingdom. Dr. Galley, thank you for your time. Welcome to COVID-19 update.
Hi, Ladi. Thank you so much for having me.
I'm sure you probably heard quite a bit of what Professor Enyang talked about with the issue of animal to human transmission. We wouldn't have been in this issue with COVID-19 or any of the things we have been in the last couple of years, except for this animal to human transmission. Speaking strictly now from a medical point, from a medical viewpoint, where do you think we got it wrong in our interrelationships between animals and humans?
Yeah, actually, I must commend Professor Eden. He spoke so very, very well, so extensively. In fact, I'm thinking like I don't have anything to say, but be that as it may, to answer your question, I would say, yeah, you see, there's something we call One Health, in which it has to do with the health of the humans, the animals, and the environment. Here in the UK, there are regulations. You don't just raise animals at home just like that. But back home in Nigeria, you see a house, you're having human beings, and you're raising cows, or you're raising pigs, or you're raising goats in the same house. You're living with the same animals. So you see, the problem is back home, some of our policies or some of our people don't really see the threat in some of these things. They actually see these animals as if they are colleagues or they are brothers. However, these animals are not the way you think. When Professor Eden was talking about zoonosis or zoonotic diseases, it's true. Some of these animals are natural reservoirs, meaning they will have some of these bacteria or some of these viruses or some of these parasites in them, but they don't become sick or they don't come down with illnesses because they are natural reservoirs. But once if this bacteria or these viruses cross from this animal to human system, then the human being now become ill. You understand? So these are some of the issues that our people really need to work on it. And going back to COVID-19, for example, if we trace it back to Wuhan, just like the publications are saying, this COVID-19 was gotten from a wet market where they deal with live animals. If you watch some of the videos, you see how they handle animals as if the way they handle animals, you could just imagine what will happen. So just like Professor Edem said, there are other viruses, sorry to say, but in microbiology or in virology, there's something we call emerging and re-emerging diseases, right? So more viruses, more bacteria, more parasites that are more virulent. When we say more virulent, meaning they are more, should I say, dangerous than what you think you know will be coming. So people should just brace up and people should prepare. So I think that's what I have to say about that.
The other thing that comes up with the issue of this animal to human transmission is, as Professor Eden pointed out there, the whole issue of consumption. People, it's not just about interacting with them, it's the consumption as well as the mode of consumption. Some of the videos you made reference to in your earlier statement, which were seen online, had people eating some of these animals raw, and some of them half-cooked and all of that. Do we have a way of preventing this? Do we have a way of preventing this beyond just enlightenment, so to speak?
How I wish we have, how I wish. You see, the thing is, I was trying to say something. It is not just enough to say, okay, policies are working in Western world like the UK or the US. Then the government is trying to copy the policy and bringing it back to Nigeria. It's not going to work. One thing is for you to copy the policy. Another thing is for you to apply it very well. You separating Nigerians from eating bushmeat or from eating raw meat is like 29th of February, which is very, very rare to come by. So what I'm trying to say is, if people actually understand the danger in eating some of this raw meat, or some of these animal products like consuming milk that is poorly pasteurized, people will actually understand that they don't need to do it. So beyond the enlightenment, beyond telling people, the simple question now is, back home in Nigeria, how many people have light to even watch this enlightenment we're talking about? How many people? And that is why people back home in Nigeria hardly believe that coronavirus is real. But to be frank with you, COVID-19 is real. Because if COVID-19 is not real, you don't expect the whole world to shut down its economy just because of something that is fake. So that is to tell you that COVID-19 is real. So our government needs to think of strategies that will work in our own climate, that is back home in Nigeria. You go to the house, you go to the villages, you tell people that don't eat raw meat, don't do this, don't do that. You have to tell them the implication. Don't just say, okay, wear face masks, wear hand gloves, use hand sanitizer. How many of them even have the money to buy the hand gloves or the hand sanitizers? If you get what I mean? So involving religious leaders, involving celebrities, involving even the NURTW, people in the motor park, will go a long way in sensitizing the people. So it's not all about the radio or the television. We have to go down to the grassroots.
I have enough time I have enough time to just ask you this as a final. Earlier on this evening, we had Prime Minister Boris Johnson in the UK, where you are there, talking about further restrictions, further easing of restrictions there, and that he hopes that things would probably return to more or less normal November, but certainly before Christmas. Are you as optimistic as he is, given the fact that you live there?
Yeah, me living here, I'm optimistic. Why? Because people here in the UK actually obey. They listen to rules and regulations. As I talk to you, if I'm to go to work, if I'm to use the bus, the stagecoach, for example, I'm expected to use a nose mask. If I don't have a face covering, the bus driver won't even stop for me from the first place. And even if I have a face covering, if the bus formerly was having 100 capacity, now the capacity has been reduced to 50. So if you sit on this seat, the next seat, they will tell you don't sit on this seat. Another passenger will sit at the other seat. Are you now seeing the regulations put in place? The bus driver is adhering to that. The passengers are adhering to that. But back home in Nigeria, the government will come out and say, okay, these are the policies. We're trying to protect these people. But the same people will go against it. You go to a motor park, the conductor is trying to choke people because he needs money. The driver is trying to carry overload because he needs money. The passenger wants to enter because he wants to get to his destination. So you see, that's the problem. So I am optimistic that here in the UK, things may work. But again, if you listen to what he said, like one of the questions from, is it journalists from BBC or so, when they were asking him, how sure are you? What if we're expecting, we're preparing for the worst, but expecting the best? What if the worst happens? He now say, fine. The timetable is not as if it's sacrosanct that, yes, we must follow it. As we go ahead, if things are getting better, we're going to be easing it gradually. But if things are getting worse, we're going to tighten it. So that's how the system works here. Back home in Nigeria, you said, okay, people should come back, people should go to church, but you said people should not go to school. Why? The thing is, in this same church, you are having a mass gathering in one place, but you said they should not go to school. How?
Which is another mass gathering, isn't it?
You understand what I'm saying? Here in the UK, church or masses are divided into two, Saturdays and Sundays. In Saturday, you go to mass in the morning and in the evening. Sunday, you go in the morning and in the evening, and there's capacity. Even if people, 100 people came and there's capacity, that if the church is full to capacity, that the government put restriction, you don't go to the church. But back home, how many people listen to that? They don't. So with due respect to where I'm coming from, which is Nigeria, I don't see reasons why you open the market, you open the church, you open the mosque, but you refuse to open the school. Because in this same mosque and this same church, in this same market, they don't even obey the guidelines. So why are you keeping the children at home? If the people cannot obey the rules, then why are you keeping the children at home? They should allow them to go to school. Because I believe you controlling people in WAEC hall, students that are sitting to write WAEC, will even be easier to control them than to control people in the church or in the mosque or in the market. If you get what I'm saying. I'm a PhD student here. Yeah, I'm a PhD student here in Sheffield. I don't have access to the lab. I do most of my presentation or most of my things online. That is because we have light, we have a strong broadband. But back home in Nigeria, you said they should do online learning. Do you have a good network? How many of these students can afford a good phone? How many of them can buy data to even log in? How many of them are used to Zoom or Webex or Blackboard Collaborate? How many of them, how many lecturers even know how to use some of these things? If you get what I'm saying. So
points to ponder. Raphael Peter Gale, virologist, Faculty of Medicine, Dentistry and Health, University of Sheffield in the United Kingdom. Thank you so much for your perspective tonight. Thank you for joining us.
Ladi, thank you so much for having me. And anytime you need me, call on me. I'll turn up.
Thank you very much. Thank you indeed. British Prime Minister Boris Johnson says coronavirus restrictions will ease further in England under plans for a significant return to normality by Christmas. Under the new guidelines, people may use public transport, while advice for employers will change from August the 1st. The Prime Minister explains that companies will now have more discretion to bring staff back to workplaces if it is safe to do so. Meanwhile, cases of COVID-19 have now surpassed 13 million around the world, and more than 590,000 people are dead. Countries such as Brazil, India, and South Africa are still seeing huge rises in infections. But while countries are still facing the first wave, a number of countries such as Japan, Australia, and Iran, are already seeing a second wave. Let's take a look at more developments in our COVID-19 Global Update.
Unveiling the next steps in the easing of England's COVID-19 restrictions, certain businesses, leisure settings, indoor performances and sports stadiums have been given the green light to start welcoming people back in the coming months. Announcing the plans, British Prime Minister Boris Johnson says his government is hoping for the best, but planning for the worst.
Throughout this period, we will look to allow more close contact between friends and family where we can. It is my strong and sincere hope that we will be able to review the outstanding restrictions and allow a more significant return to normality from November at the earliest, possibly in time for Christmas.
Thank you very much, Mr. Speaker. With permission, I'd like to make a statement.
Meanwhile, Health Secretary Matt Hancock has called for an urgent review into the compilation of the coronavirus death data in England. It comes after it was confirmed that the number of reported deaths included people who had tested positive months before they died.
For weddings and corporate events.
Away from the UK, Australia's New South Wales state has banned dancing, singing and mingling at large-scale gatherings as neighbouring Victoria reported a record daily increase in COVID-19 cases.
Hold on.
In other developments, researchers in the country have devised a test that can determine the coronavirus infection in about 20 minutes using blood samples. The test can determine if someone is currently infected and if they have been infected in the past. And in the United States, the daily total of new cases has hit another record with 68,428 new infections in 24 hours. In that period, the death toll also climbed to 974. Meanwhile, in Texas and Arizona, morgues are filling up and officials are bringing in coolers and refrigerated trailers to store bodies.
This is a morbid topic, and it's not one that we enjoy talking about, but it really does underscore the severity of COVID-19 in our community.
Other countries are also struggling with spikes as well. Brazil has surpassed 2 million cases of the virus raging through Latin America, and India has become the third country to top 1 million cases.
Take responsibility for protecting your health and that of others by wearing your face mask while in public places. Our website, channelstv.com, has all the information and statistics on COVID-19 cases across states with regular updates on regulations and guidelines to contain its spread. Our website also has the latest news. All you need to do is log on and access the news in health, politics, business, sports, in Africa and around the world at your fingertips. For all your updates, do log in and access the news in real time. Thanks for watching. I'm Ladi Akiridoluale. Do have a great weekend ahead and stay safe.